Many people have been hesitant to seek medical care for issues not related to the coronavirus. But this can often cause some big problems. Health reporter Benita Zahn joins us with more. Benita.
Elaine, you know, we've been reporting on the drop in the number of patients going to hospitals for emergency care. They worry they'll contract COVID-19, but waiting can make their situation worse. Just ask Mike Mario. He knows firsthand the importance of getting to the hospital in time. Closing in on 70, Mike Mario counts his blessings. Married with 2 grown daughters, 6 grandchildren, abundant happiness. But it almost slipped away in early May. A diagnostic kidney procedure triggered a bleed that went unnoticed until it caused another problem about a week later that threatened his life.
About 7 days ago, I was getting chest pains up here in my shoulder. I thought it was just gas, and I didn't want to go back to the hospital because I'd have to go into the emergency room and all that. And, you know, I figured if any viruses are, they might be in there. And I was a little worried about that.
Fortunately, his family pressed him to go to urgent care. Very quickly, an ambulance was called because the medical staff found he'd suffered a heart attack and was very anemic, so much so he would need 3 units of blood. But that would have to happen at Albany Med. First stop, the emergency department. So he had to face his fear of contracting COVID-19, which he quickly realized was unfounded.
They brought me to a private room. They were having private rooms now. They didn't want to put people together, which was perfect.
We are taking all the safety measures. There is nothing to be scared of.
As Dr. Mishra Pani explains, and Mike learned firsthand, COVID-19 patients are separated from all others. And with the hospital census down, there are floors dedicated only to COVID patients.
I would advise them to come early rather than wait in the house.
Now that Mike's fully recovered, he wants to make sure others don't waste time like he did. He knows he's fortunate, and he's thankful to all who helped him heal.
The main thing I want them to know is don't hesitate. It can save your life.
Mohawk Ambulance says too often since the pandemic hit, the patients they've attended to were sicker than they would have been if they didn't let fear get in the way. And the American Heart Association's been warning for weeks, do not ignore signs of heart attack or stroke because every minute matters. Jim?
Good advice, Benita.